Hello and welcome to Dialogue. The latest coronavirus outbreaks in northern China come weeks before the start of the country's biggest national holiday, the annual Spring Festival. So how serious are they? With hundreds of millions set to travel soon, will China's existing virus control measures still work? And as mass vaccination campaigns get underway around the world, how are things going? And have there been any setbacks? To talk about these issues, I'm now joined by Dr. Hua Chunzhu, Associate Professor at the State Key Laboratory of Emergent Infectious Diseases at the University of Hong Kong. And later we'll be joined by Dennis Carroll, President of the Global Viral Project, and Dr. Alan Whiteside, CG Chair of Global Health Policy. That's our topic. I'm Zhou Yue. So, Dr. Zhu, faced with a new round of COVID-19 outbreaks, 11 regions in 3 provinces here in mainland China have adopted lockdown again and rolled out free massive nucleic acid testing. How serious is China's latest outbreak, in your opinion?
Okay, so I think that in the past 10 days, we see a sudden increase in the confirmed cases in mainland China, but still the situation is kind of under control. And compared with what we have seen last year, we are now more experienced and know how to focus our medical resources and efforts to the specific region that report the confirmed cases. And I think that previously, last year, at that time, we barely know anything about the virus. And but I should say that currently we still face a lot of, for example, there might be more virus variants, and there are more infected cases globally, and we are under this kind of pressure of imported cases. And sometimes the virus can contain the environment and also some substances, so that we are facing different situations now.
And another worrying thing is that the cluster infections mostly involve asymptomatic patients, and it happened in the countryside. So do you foresee this as a new trend of spreading?
I agreed. I think that because we have been co-living with COVID-19, the SARS coronavirus 2 for almost 1 year. And this is kind of a protracted war against the virus. So I can see that many people, especially those living in those less densely populated regions or the rural area, they kind of lose their vigilance and no longer keep so alert to the virus or the situation. But the virus can actually re-emerge from anywhere that if there's any vulnerable point. So we should still keep ourselves alert and also keep a very close eye on the development of the situation.
And actually, as a method of response, lockdowns are now enforced in many parts of China, especially in northern provinces. Is there anything new we should learn from the current outbreaks? Because considering the backdrop is that the national holiday, Chinese New Year, is just around the corner, do you think tougher measures will probably enforce this time around?
So as an infectious disease, I think the most important thing is to break the transmission trend. So we can see that recently there are some new trends or tendency. For example, the virus may have a longer incubation time before we can detect it, or the patient has the onset of the virus shedding or the symptom. So we need to keep the disease control and prevention measures, such as carry the face mask and also wash hands frequently and keep all the good hygiene and good the healthy living habits. And I think it's also quite important to let our people understand that keeping the social distance and avoid the non-necessary traveling if possible. So,
but many of them are supposed to go back to their hometowns en masse. Do you think that's necessary travel?
No, I don't think so because I think that first nowadays we can use like online meeting, video chatting to have more close contact with our friends or our families. But because during this cold season, usually the virus transmission, the survival of the virus in the environment will be much easier. So to keep the benefit of our country and also to maintain the good situation of fighting against this virus, I think that we should avoid this kind of mass movement or traveling.
Even during
during
the Chinese New Year holiday, you mean?
Yes, yes.
And
Yes,
also,
I understand that people they miss their families, but we can use other holidays to visit them, especially during the warmer season.
all right. And also, there is evidence supporting that the recent outbreaks are actually originated from imported virus infections. Many cities actually have already tightened their regulations on imported food, supplies, and there are still very stringent quarantine for inbound travelers, and quarantine time has been stretched from 14 to 21, even 28 days. Do you think this is the cost we must pay, and will there be any adjustment?
I think that is pretty necessary because we know that there are more and more cases recently, especially during this winter. And I think that we're facing more diverse and more variants of the virus. And we don't know whether there might be some more virulent virus with better transmission. And also, we need to make sure that there's no new situation caused by this reemergence of the virus and outbreak. So I think we still need to keep very alert and have all this early detection, early reporting, early isolation and treatment for those confirmed cases or infected cases.
And Dr. Zhu, many countries are already carrying out their rollout of vaccination programs, but it is indeed a race against time because highly infectious variant was found in many countries, especially in the United Kingdom, South Africa, Brazil. And the latest news is that a new strain, a fourth strain, was discovered in Germany. So how do you see the virus evolve in such a fashion? And as the new strains going to be more deadly, less deadly, more infectious or less infectious? Do we see a pattern there?
So because the SARS coronavirus 2 is actually an RNA virus and it can mutate it quite rapidly, so it is actually not that surprising to me when we see this kind of new variants or new mutations. I think that with more people having the antibodies against the virus, we can expect that the virus can get more and more adapted to the human beings, and also we might see some new mutations against the antibodies in the future. So, but so far the good news is that all these variants, we know that some of them may have been more transmissible, but there's no reports about the virulence, the enhanced virulence or the resistance against the vaccines or the treatments. So I think that it's quite important. We need to have more investigation and risk assessment about these new variants and keep a closer eye on these new variants and make sure they are not really causing bigger risk.
You say that the current vaccines are still effective against those variants, but will it remain so? For how long?
No one can answer this answer so far. So I would say that currently all these mutations, they are still relatively minor, but what would be its consequence? No one knows about that. We need more experience, more experiments and more investigations on it. And when would the virus obtain the resistance against the virus, the vaccines or the treatment? We don't know about that. So this is why we have to keep on the surveillance, and also the detection and all these control measures.
And also about the safety of the vaccines, because the recent news about 33 people died in Norway within days of receiving their first doses of the Pfizer vaccine. And according to the Norwegian Medicines Agency, all of those who died were 75 or even older, and there's no link established between the vaccine and the death. But still, people worried about the safety of the vaccines, especially for the elderly. Do you worry that, Dr. Zhu?
Yes. So at the very beginning, when I heard of this news, I'm kind of worrisome and feeling a bit disappointed. But after I reviewed the data and found that all these people, they are quite elderly people, I think that it actually makes some sense to me. So the problem is that these elderly people, they usually have more underlying medical conditions, and they are actually the group of people with the highest risk. So we don't know whether this kind of death rates is directly related to the vaccination, or there might be some other kind of underlying health problems there. So it still need more data, and I think that probably they can consider another vaccination strategy. For example, keeping those people more in the quarantine region, or less contact with those high risk of the population. And then probably if you vaccinate people surrounding them, that can actually provide a safer situation or environment for them.
And we are now joined by Dr. Dennis Carroll, president of the Global Viral Project. So, Dr. Carroll, of course, there are a lot of death happening in the U.S. in the nursing home. So, whether the vaccines can work safely on the elderly is very important. Have you heard about the Norwegian death, and what do you think?
Well, first off, thank you for inviting me in this discussion. Yes, I am aware of the reports out of Norway. And as your previous guest mentioned, we're always concerned about possible adverse effects associated with vaccination. But it's not clear at all that there's any relationship between the reported deaths and the vaccine itself. In the United States, we've vaccinated almost 12 million people, and the only adverse effects we've seen have been largely the predictable sort of mild, relatively mild adverse effects, and we haven't seen deaths associated with the rollout to date. So I think we need to be cautious. We always need to be mindful that there's a risk with every vaccine, and we need to have clear understanding of those events that are associated or not associated with the vaccine itself, and make a clear distinction. So at the moment, it's a point of concern of what's happened in Norway, but it's very unclear as to whether the vaccine had anything to do with the deaths. It's an anomaly from what we're seeing elsewhere in the world.
But Dr. Zhu, currently China is limiting COVID vaccine shots to people under the age of 59. That means it will leave the elderly without protection. So do you know why this is it? What is the justification for that?
Okay, so I think that first that based on our clinical trial data, we don't have a group of older age population for the trial. So this is the reason why we don't want to take the risk to vaccinate those very old people and the very young people. So there's an age limit at this moment. But I think gradually, with when we have more data and we gradually prove that our vaccine is safe enough, we can probably expand our age group That's one thing. And the other thing is that because currently in China, the outbreak is not that severe compared with the Western countries. So if we can protect those people with a lot of contact and with higher risk, then these people, if they are immune against the virus, then those people with the elder age, they are also protected. So I think in China, we are actually using a different vaccination strategy. We protect those people with more occupational exposure, and then by this, we can keep our elderly people and also those very young children in a relatively safer situation.
And Dr. Carroll, obviously vaccination is still the key here, but in the U.S., the death toll is rapidly approaching 40,000, 400,000 actually, almost as many Americans who died in the Second World War. But mass vaccination began last December, but only 31 million doses distributed across the country, only 12 million have been used. So why the delay? Dr. Carroll?
Well, yes, thank you. Obviously, vaccinating 12 million people since December is well below the target. Originally, the target was 20 million people by January 1st. And it's clear that the rollout of the vaccination campaign has been met with many different challenges. And that is cause for concern. What we're optimistic about is beginning tomorrow there'll be new leadership in the United States, and that new leadership under soon-to-be President Biden has looked very carefully at the challenges and the issues that have come up over the last 6 weeks during the rollout of the vaccine, and they've taken steps that will be initiated beginning tomorrow. That we think will lead to a dramatic increase in the number of people that will be vaccinated. Their target is 100 million people to be vaccinated in the first 100 days of President Biden's administration. And the plan that they have rolled out really reflects, I think, many lessons learned over the last 6 weeks on how best to make this vaccine available for use at clinics and at health centers. So a rough start, but I think we'll turn a corner rather dramatically beginning tomorrow, and we'll see a dramatic increase in the number of people that will be vaccinated in the United States based on a new and revised and clearly a much improved plan.
As you said, President-elect Joe Biden vowed to give 100 million doses to Americans. But what is holding Trump back? Is it the production, distribution, logistic? Why it won't be a problem for Biden?
Well, the big difference is that the incoming Biden administration has dedicated a full commitment of the federal system from the White House through all aspects of the U.S. government, and has taken steps to create a much more coherent, coordinated strategy between the federal government, the states, and local communities. And that had not been in place over the last 6 weeks. So I think what you're going to see is tapping into the full range of resources and capabilities that exist across the United States at the federal level, state level, but also importantly in the private sector. And so we'll see a dramatic increase in the number of different points of outlet for this vaccine that had not been available in the past.
And we've also collected some comments and opinions from social media users. Let's take a look what some of them have been saying on this, the vaccination and the latest development of COVID. Rebecca McLeod said, "It got me thinking, what happened to us? Nowadays, people will refuse a scientifically proven vaccination, one which will protect our most vulnerable simply because it is their right. They will refuse to participate in a global need for fear of the unproven and unknown." So, Dr. Carroll, that is a problem, vaccination reluctance. some people still perceive the danger of the side effects to be greater than the risks of the disease. What do you make of the anti-vaccination positions of some people, especially probably in North America, in your country? What should the public health community do?
Well, first off, it's not unexpected that there will be segments of the population that will express concerns and even reluctance in getting the vaccine. We've seen that with other vaccines as well. You know, people have rightfully should be concerned about potential side effects. I think the most important thing to understand, though, is that both the field trials and the most recent rollout of the vaccine, and as we've said, 12 million people have been vaccinated in the United States. We are seeing that whatever adverse effects they are, they're relatively mild, and they certainly are adverse effects that can be treated very easily and quickly at a health facility, which is in stark contrast to the COVID-19 illness itself. As we know, we do not have a treatment for COVID-19. So the choice is between having a vaccine that will provide life-saving measures against what might be a mild allergic reaction that can be treated very easily. But even at that, very few people are showing mild reactions as it is. So I would hope that having open, transparent visibility on the adverse effects as they appear and making it clear how easily manageable they are will convince people that there's far more to be gained by being vaccinated, that lives will be saved being vaccinated, and increase the number of people who have confidence in this vaccine. It's about building trust, and I think we need to be very careful as we roll the vaccine out that we take full account for all possible side effects and have that trust-building transparency.
We have Dr. Alan Whiteside joining us, talking about trust building. Dr. Whiteside, according to The Lancet, a report released in October 2020, a nonprofit limited company found that since 2019, anti-vaccine social media accounts increased their following by 7 million, pushing the number of people following such groups to 31 million on Facebook and 17 million on YouTube. So as Dr. Carroll mentioned, maybe we can prove the scientific legitimacy of this, but there are still people who refuse to take the vaccines. And will that diminish the relevance and importance of vaccination programs?
Well, if you don't have a significant number of people being inoculated, then of course there is a problem in terms of the coverage and the possibility of pools of infection. I find it very hard to understand the anti-vax group because we know that the common good far outweighs the possibility of what we've seen so far, which are very minor and rare adverse effects.
And there's also another question that is haunting the world, that is the disparity of allocations of vaccines. So Mr. Whiteside, would you please give your take on this? Because Pfizer's announcement of temporarily reducing vaccine deliveries to Europe, keeping supplying America, has created some anger over the fair distribution, and some developing countries are even more desperate to get hold of any vaccines at all.
That's absolutely correct. When I look down at the list of where vaccines are being distributed, apart from a few countries in the Middle East, most developing countries do not appear. So at the moment, we've got 14 million doses having been given in the US. Second is China with 10 million, and third is the United Kingdom with 4.5 million in terms of countries, which means that the US is vaccinated approximately 5 per 100 people. The UK 6.7 per 100 people. China is bringing up the rear at 0.7. But if you look at other countries like Kenya or South Africa, then they don't even feature on the statistics at all at the moment. So there is a real disproportionate ignorance of or ignoring of the developing world.
And also, there are different versions of vaccines on the market using different technologies. Pfizer, Moderna, using mRNA technology, China using inactivated forms of the virus, and Russians are adenoviral vaccines. So probably average users don't have deep knowledge of those types of vaccines. Can you please explain to us what are the advantages and disadvantages, and what kind of people should be using what kind of vaccines, Dr. Whiteside?
Well, at this point, I would say anybody who can get access to a vaccine should simply use it.
Okay.
What you pointed to is different methods of delivery of the vaccinations. What you didn't mention, of course, is the price, because the cost of the vaccines ranges from about $3, and AstraZeneca has said that they will provide vaccines at cost, all the way up to $15, $16. We don't have costs yet for the Chinese manufactured vaccines, or indeed the Russian one. So I think what we have to do is to weigh up a whole lot of different criteria, from effectiveness to cost to how it's delivered. But at the moment, the main emphasis has to be on rolling out as many vaccines as possible around the world. I also think it's incumbent on people to recognize that there will be periods when we have to reduce production because we have to upscale the plant. So that's nothing unusual. If they were to close the plants, that would be a different matter entirely. But if it's to make it then become more efficient, then that's an entirely acceptable reason.
You mentioned effectiveness. There is some controversy about the Chinese version. The Brazil's Vaccine Institute, Butantan, announced that the Sinovac vaccine, the Chinese version, was only 50% effective in late-stage trials, below the efficacy rate it previously posted of 78%, while the Indonesia data says it's 65%, and Turkey said it's 91% effective. So why there are different data showing about the effectiveness of vaccines?
Well, I think the answer is we just don't know the data. And one of the things which I think China has been a bit lax about is releasing the data on their vaccines. So most other countries have had development, they've had trials, and then they've had approvals, and all at every stage along the way they've released the data about the vaccines. Both China and Russia have been very slow to do this. I don't know why there is this huge difference, and that's something which we'd love to know, but in order to assess that, you need to have the information. You need the raw data, and we're not getting it.
And Dr. Carroll, I want your take on the rollout speed of the vaccinations in 2021. Do you think with all those versions available, we will be able to vaccinate most of the people on the earth in 2021? Dr. Carroll?
No, I think unfortunately the scale up of the vaccine production clearly won't enable us to be vaccinating 8 billion people. I think what we really need to do is to make sure that we take a much more strategic approach and target the most vulnerable populations before going to the less vulnerable. So I would hope in the United States and Europe and elsewhere in the world, as we meet our needs for dealing with the most vulnerable, that we join with other countries to ensure equitable distribution. What will be a shortage of vaccine throughout 2021 so that the other countries in the world, as your other guest mentioned, do have access to a vaccine that they currently do not. And I would hope the incoming Biden administration will provide some real leadership in helping to bring a more equitable availability of the vaccine over the course of 2021.
Okay, thank you very much, Dr. Carroll, and thank you, Dr. Whiteside, for your insights. And you've been watching Dialogue here on CGTN. I'm Zoe in Beijing. Thank you for watching. Goodbye.